We will continue with the discussion of the spleen channel of foot Taiyin. The area around spleen 7 and spleen 8 will also show changes in patients with gynecological conditions. This includes painful menstruation and irregular menstrual cycles. The nature of palpated change will vary based on the underlying pathodynamic. For example, there may be weakness or softness in the area of spleen 8 and spleen 7 and spleen 8 in the case of deficiency. And if there is stagnation or cold, there will be nodules. Or where there is excess, there is severe tenderness. Nodules may also be found in cases of uterine fibroids, ovarian cysts, and endometriosis. So if you would like to probably determine if there is a possibility of myoma, you might want to press the area around spleen 7 and spleen 8. In men, changes in this area are relatively rare. However, as the sheath cleft point of the spleen channel, spleen 8 will often be tender in cases of acute pain that involve the pathway of the spleen channel. So here you could see the location of spleen 7 and spleen 8. The area around spleen 9 will often show changes where there is deficiency. So there will often be a soft tenderness where deficiency has led to dampness or a counterflow of Taiyin Qi transformation. Recall that counterflow, which is the irregular movement of the Qi, is often treated with the uniting points. The area around spleen 9 will often be very tender in gynecological conditions. It is extremely tender in women before and during menopause. So for women out there who are menopausal, you might want to press the area around spleen 9. In such cases, the area can be treated with a strong draining technique. Spleen 9 is also often painfully tender in the presence of UTI. So to summarize, let's start with spleen 2 and the area. If you have hardness on the area of spleen 2, spleen 3, that is spleen deficiency with excess dampness. So softness or weakness in the area of spleen 2 or spleen 3 will tell us there is spleen deficiency. So if you wish to confirm your diagnosis of spleen deficiency, you might want to palpate for softness or weakness along the area of spleen 2 or spleen 3. If there is sharp pain along spleen 3, that means there is dampness and heat. So there may be ice, maybe spleen organ type. Okay. So then if there is soreness in the area of spleen 3, there could be generalized dampness patterns. Now let's go to spleen 5. If there is sharp pain in this area, there is damp heat in the face. So they will this will have corresponding mouth sores as well. If there is soreness, spleen 5, there is imminent outbreak of mouth sores or dampness. So let's go to spleen 6. If you feel a soft nodule here, there is deficiency, possibly cold in the lower burner. If there is sharp pain at spleen 6, there is excess accumulation involving the spleen, liver, and kidney. If there is soreness at spleen 6, there is deficiency involving the spleen, liver, kidney. If there is softness or weakness, there is chronic deficiency affecting the lower burner. So for spleen 7 or spleen 8, softness or weakness, there at spleen 7 or spleen 8, there is deficiency. Could also be kidney spleen yang deficiency. There could also be severe tenderness at spleen 7 or spleen 8, gynecological conditions involving excess. And if you are able to palpate some nodules here, there would be gynecological conditions involving cold. And finally, for spleen 9, if there is softness or weakness, there is a deficiency type Taiyin counterflow. And for hard, if there is hardness along spleen 9, there is excess dampness accumulation. And if there is pain on spleen 9, there could be gynecological or hormonal conditions, often menopause.